Closing the gap comprises a lot of issues: health, education, employment, training.
Everything that I advocate for is about giving the power back to Indigenous communities.
Because at the end of the day, they are the ones that are going to have to make the tough decisions about changing their lifestyle.
We want to be a part of this community. We don't want segregation. We don't want a division in our lives. We want to have the same opportunities as the rest of Australia.
The idea today was to try and identify those services that provide assistance to the Aboriginal community.
One of the greatest things about these gatherings is that it brings a community together with specialists from such a broad field.
And the key things that we see occurring again and again is the issue of chronic disease in our communities.
Our diabetes is through the roof, our heart disease.
It started with all the introduced foods into Australia and all the other diseases that came as well.
A lot of our people, both young and old, pass away for, sometimes for no reason at all, sometimes for reasons that were preventable.
The Aboriginal child mortality rate is enormous.
If we're going to have an impact on closing the gap, then we certainly need to have a focus on what sort of supports, what sort of interventions we're going to have with young people, so that our next generations don't have to go through some of the difficulties that we've experienced and that our elders have experienced.
If Australia doesn't become one sometime in the future and we still go on our journeys separate to each other, then these problems are going to be here for years and years to come.
The supports are there, the opportunities are there. We just need to be able to access them and provide them in a better way.
What is working in each other's communities, and try and implement what we are not using and bring that together so we can have something that is more engaging.
Give them the choices, give them the options, and then let them make the decisions. But support them.
The more we can create education about our health and our way of life and our living, better, and the more successful we as people will be in this country.